Next!
1 week, sore throat, fever, and swollen glands in the neck.
Say ah!
Ah.
Group A strap! Amoxicillin! Next!
Well, it was about a week ago. I was coming back from visiting my Aunt Martha in Cleveland, and I was sitting on the plane, minding my own business, and here's this kid with sneezing and coughing, and a few days later, I began to sneeze and cough, started to feel all achy, and I have a lot of drainage.
Sounds viral!
Well, my kids have all had ear infections. I don't have an earache, but I'm thinking maybe it's a sinus infection, something like that.
Parodies! Next!
Are you sure? My nose has been stopped up.
Pseudoephedrine! Next!
How about a Z-Pack? I mean, those have worked in the past.
No pills for you! Next!
Yo, Dr. White.
Hello, Jesse. How are things?
Not good, Dr. White. I haven't been sleeping this past 2 weeks.
Well, Jesse, you've been under a lot of pressure lately, especially when you consider all the product we've got to ship.
Yeah, I feel like I got no energy, and get this, I've been thinking about death a lot lately.
Well, now, Jesse, we know that's all part of the game, but we've got a lot of product to put out, and we've got deadlines. That
Listen, Dr. White, I can't think or concentrate, and I feel guilty all the time. That ain't normal, yo.
You know, it seems like you meet the criteria for major depressive disorder.
Are you experiencing any of these signs of depression? Remember the mnemonic. SIG-E CAPS. Sleep disturbances, loss of interest or anhedonia, feelings of guilt or worthlessness, low energy, poor concentration, appetite changes or weight change, psychomotor retardation or agitation, suicidal ideation. If you experience 5 of these symptoms for at least 2 weeks, and as long as you either have depressed mood or anhedonia, that's major depression. If you're experiencing symptoms of depression, better call Saul.
I'm Luke Hallwalker, and I'm here to examine you.
Aren't you a little young to be a resident?
Patience, my young Padawan. Do not give in to fear.
But Master Kenobi, I've never seen anything like that before. Is it an imperforate hymen?
This is not the pathology you are looking for.
This is not the pathology that I'm looking for.
That is no imperforate hymen. That is vaginal atresia. It is often confused with imperforate hymen, or a transverse vaginal septum. It occurs when the lower vagina fails to develop and is replaced by fibrous tissue. The cervix, uterus, ovaries, and upper vagina are all normal. It presents during adolescence as primary amenorrhea and cyclic pelvic pain.
Help me, Obi-Jin Kenobi. You're my only hope.
With all of this stuff in the way, how am I gonna see?
Search your feelings and use the forceps, Luke. Use the forceps.
Red 5, going in. Dr. Yoder?
Come in.
Dr. Yoder, I'm Luke Hallwalker, one of the interns.
Precedes you, your reputation does. You wish to become a great physician like your father. It is knowledge of medicine that you seek?
Yes. It's just this patient I have. She's got a Phyllodes breast tumor, and it's just so confusing.
Ah, the rare Phyllodes tumor. Look like a fibroadenoma on mammogram, it does, but larger and bulkier. Though malignant it can become, most are benign.
So you could just follow it with serial mammograms, and then do a biopsy if it continues to grow rapidly.
Yes, needle or excisional biopsy you can perform.
Dr. Yoder, why do you talk all backwards like that?
Backwards talking, am I?
Yeah, you're like really hard to follow.
When 90 years old, you reach talk so well you will not.